Good morning, Mr. Mealer. I'm Stephanie. I'm a Greenville Tech nursing student. I've checked the order. The doctor wants us to change your dressing today. Is that okay with you?
Yes.
Is there any pain with it right now?
No.
Okay. Are you comfortable where you're laying?
I am.
All right. I have a little bit of stuff with me. All it is just items to change your dressing. It is going to be a sterile procedure once I get the old dressing off. So it might take me just a few minutes to change gloves, do some hand hygiene, and then we'll get started again, okay?
Okay.
I do need you to wear a mask, and due to your facial hair, I'm also going to need you to turn your head just so that way there's no chance of you contaminating it at all.
Okay.
You want help putting your mask on?
Yeah, I think I can get it.
All right.
Thank you.
You're welcome. I'm going to have a mask on myself. So you did say that there's no pain with your dressing at this point? No pain with your site?
No.
Okay. I'm just going to feel on it before I take it off as well, just for checking for any edema, redness, anything like that. You haven't had any problems with it?
No.
Okay. None of this is hurting?
No.
Alrighty. Well, I'm going to take it off, and I'm going to start from the distal area, and I'm going to the proximal. Just let me know if I am tugging on that catheter. I am trying to secure it as well. I'm going to take that bio patch too. Alright. I'm going to take my gloves off and get changed, okay? Get the sterile field set up. And my trash can is over there. I have my sterile kit. I'm just getting things set up, okay, Mr. Mealer?
That's good.
Get my sterile gloves on. I do have an extra pair just on the in case these things are a little small, so if you hear me over here rustling with paper, that's all that it is.
Okay.
Do you have any questions for me this far?
No, I'm good.
Okay, I'll let you rest. You let me know if you need anything.
We'll do it.
All right, just ensuring I can get my sterile gloves on. And I knew they would be a little small. Still touching the cuff. Now get into this one. Stepping back to make sure that I am sterile. Do you have any family, Mr. Mealer?
No, just lonely.
Just lonely. Well, I'm sorry to hear that. All right. I'm going to get my sterile field out and get it set up. All right, Mr. Mealer. I have some alcohol here. I'm just going to clean around your site. Just any old blood or drainage. Circular, not trying to get into that site, but just in case I don't see any. But we don't want to take any chances either.
Good deal.
Is that hurting?
No.
Uncomfortable at all?
No.
Okay. Just going around to ensure that I don't get anything on my sterile field. I'm going to let that dry a little bit. We don't want to mix anything. Is that hurting?
No.
All right. The next thing I have is some chlorhexidine. If you hear a little crunch, that is just to ensure that the medication can get into the sponge. I'm going to start at the insertion site, and it should be a little chilly. Good and saturate it so we get it clean. And then I'm just going to scrub back and forth around it, get all that area nice and clean. Starting from the top, and we're going to go all the way to the bottom. And it's going to take about 30 seconds. And then we're going to let it dry for a good 2 minutes. With my non-dominant hand here, I'm going to go ahead and just hold on to the catheter, and I'm going to clean it. Make sure we get it good and clean.
Okay.
Feeling any discomfort?
No.
All right. All right, we're going to let that dry. That'll be 2 minutes of drying. We're going to wait. I have a couple more things to do, and then I'm going to be out of your hair, okay?
All righty.
This is a bio patch, and I'm going to put it on your catheter to make sure that we keep all those microbials out. And I got a Tegaderm to come around it as well, okay?
Take a what?
A Tegaderm, it's just a clear dressing that we put over it so that way we can see if there's any type of redness or inflammation going on. It gives us just a little window so we can see what's going on. And it also gives me a place to put my information that I changed it today with today's date and the time in my initials. So if there's any question, it'll be in your chart, but it'll also have my information on it.
You're the one that done this.
Yes, sir.
I got you.
Okay. And this little piece right here has my name, the date, and the time, and part of my glove. All right, Mr. Mueller, are you okay?
Good to go.
All right, thank you. I'll get my mess cleaned up.
Thank you.